This is the Fertility Friday podcast, episode number 95. Welcome to the 95th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and fertility. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. Fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility, and I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles. If you've recently discovered fertility awareness but you're not feeling confident about using it for birth control just yet, or if you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me button on my website. And I would also like to invite you to sign up for the Fertility Friday newsletter. Head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. And today I'm very excited to welcome my guest, Dr. Susan Rako, to the show. Dr. Rako has been a psychiatrist in private practice in the Boston area for more than 35 years. She both trained and taught at Harvard Medical School's Massachusetts Mental Health Center, which is a teaching hospital in the Department of Psychiatry. She has become a pioneering expert on women's reproductive health, and she's the author of several books, including The Blessings and the Curse, No More Periods, and The Hormone of Desire, The Truth About Testosterone, Sexuality, and Menopause. And in today's episode, we're going to be talking about the idea that continues to be put forth about menstruation, much to my dismay, but more specifically, menstrual suppression, the idea that periods aren't necessary, that women can exist without them, and that it's not going to impact their health at all. And so I'm really excited to delve into these topics. Thank you so much, Dr. Rako, for being here today.
It's a pleasure to be here, Lisa. I'm happy to.
Well, I gave you a short introduction, but you have an extensive, history. You've been doing this work for so many years. And so I'd love for you to introduce yourself to the listeners and tell them a little bit more about the work that you've done in this area, bringing these issues to light.
Sure. When I look back over my life, I realized that I've been dealing with neurophysiology and women's reproductive health since I worked at the Worcester Foundation for Experimental Biology in Shrewsbury, Massachusetts, in the summer after my junior year at Wellesley College. After that, when I went to medical school, I didn't know that I wanted to be a psychiatrist. I was just very interested in how our bodies work, and had always been since I was a kid. And it was in medical school that I discovered psychiatry. And that was my... I might have been an obstetrician or a surgeon, if not. And I still feel like a full doctor, even though I'm a psychiatrist, and people don't generally think of psychiatrists as doctors except to give medication. And even in my practice of psychiatry, I'm not that much interested in the medication end, but more in the therapy and growth end of things. But anyway, I was going along in my life pretty happily in most ways until I hit menopause. When I was at perimenopause, just before menopause, when I was about 48, 49, I started to feel not like myself. And no matter what I did, and I consulted many doctors who at that time weren't willing to prescribe hormones until you stopped having periods altogether, I finally found one who was willing to give me what was common at that time, which was estrogen and progesterone. And it wasn't until I tried estrogen and felt even worse that I went to the library at Harvard's Countway Medical Library and did the research and found that what I was needing was testosterone. And so that was really the beginning of all the book writing that I've done and all the research and all the going around the country and speaking and teaching people and founding a nonprofit about women's hormonal health. That's rather a long, short story.
Well, thank you for sharing that. I always find it really fascinating how people get into the work that they do. And so I just love to delve right into just the topic of menstruation. And I really liked something that you said in your book. And so I thought we could start our conversation with that. So I just have a short excerpt here. But
I'd be happy to have you read that. Sure.
Okay. So what you say is, what is at issue here is not only the monthly bleed, but the whole of the natural female reproductive cycle. The intricate interplay of hormones that rise and fall in a monthly pattern have remarkable effect on every organ system in the body and are at the foundation of natural and sexual selection in the human species. So what I find poignant about that point and why I wanted to start there is that we keep being told kind of subtly in the media and very obviously, in a doctor's office that menstruation is unnecessary. There's no need for it. Evolutionarily, women didn't bleed as much and therefore we don't need to bleed at all. And your research obviously has turned up something completely different. So I'd love to start just by kind of hearing your view on this whole anti-period thing that where we find ourselves right now.
Well, I know that you know this, Lisa, because I've read on your website that the bleed that happens when women are on the birth control pill, for example, is not a period. Even though women think of it as a period sometimes, it's not a period. It's a withdrawal of hormones during the sugar pill part of the cycle. And what birth control pills are doing, and there are other forms of birth control that also do this, like Depo-Provera, the shot of progestin, is completely throwing a monkey wrench into the normal hormonal cycle. And the thing is, I wouldn't have gotten into my work about menstrual suppression and the risks of it if I hadn't first done the work I did about menopause and testosterone. It was only by learning the essential function of the normal amounts of testosterone that our bodies make, and actually estrogen is synthesized from testosterone in a woman's body. But a woman's body produces about 1.5 to 2 milligrams of testosterone a day normally, which is about a 20th of what men's bodies produce. And we need the testosterone. We have receptors for testosterone in every organ of the body, including the brain. And when I learned what I did when I wrote The Hormone of Desire, which was the book about the function of testosterone in women's bodies, I realized that when women take estrogen in the form of birth control pills every day, it stimulates the production of binding globulin. This gets a little complex, but it's not too heavy to understand. That the more binding globulin you have, the more whatever testosterone there is in your body gets bound and isn't free to have its effect on cells. And so women taking birth control pills more or less nonstop become testosterone deficient. And that's what also happens at menopause. And when I realized that young women were going to be being deprived of their normal levels of testosterone if they went on a regimen of more or less nonstop birth control pills, that's what got me interested in doing the research, to see what other complicated issues there might be. And I found them to be pretty alarming.
Mm-hmm. Well, and it's so interesting how the argument for menstrual suppression is centered kind of around making life more convenient, right? So periods are...
That's the way the ads were. Actually, I can take credit for being a one-person effector who stopped the ads from running, essentially. I was in touch with the FDA about the ads because they were misrepresenting Seasonal, which was the first pill that was promoted for menstrual suppression. This was around, maybe around 12, 14 years ago. And they were TV ads for women jumping around and leaping, and there was stuff that said that the FDA had approved Seasonal for the purpose of menstrual suppression for convenience, which was not true.
Mm-hmm. Well, and, one of the huge points that I strive to illuminate in the work that I do as well is that, there's more than just your period. The menstrual cycle is more than just the bleed that you get. There's all kinds of things that are going on throughout the entire menstrual cycle. And there's a hormonal interplay that's so complex that's happening that is just stopped when a woman is taking hormonal contraceptives. So I would love for you to talk a little bit about why the menstrual cycle is important and how the menstrual cycle is related to a woman's health in general, not only just related to her reproduction.
This is an enormous subject, and I know that you personally know a lot about this because I read what you have online. And no, I'm not sure where you'd like me to begin. It's enormous.
Well, maybe one of the aspects actually that I haven't talked about on the podcast that you delve into in your book is the relationship between iron and menstruation. And it's kind of inverse to what we usually think about. When you bleed and you have your regular periods, some women have really heavy bleeding. So we often think about menstruation being related to
anemia.
Right. But you talk about how it's related to preventing your body from accumulating excessive iron. So maybe you could talk a little bit about that.
Mm-hmm. Yes, I can. And it's important. And I'm sure that anyone listening to this realizes that this is not a black and white issue, that there are lots of complexity to it. But one of the realities is that excess, too much stored iron just accumulates in the body. There isn't any natural way for excess iron to be released from the body. And although we know a lot about anemia, and occasionally women are anemic on the basis of many different factors, including vitamin B12 deficiency and folic acid deficiency and other things like that, most normal women get plenty of iron. You can get all the iron you need from 1 cup of breakfast cereal, for that matter. Lots of foods are fortified with iron because it's a cheap thing to add to food, actually. It's pretty easy to be added. And the thing about iron is that it causes damage to the linings of blood vessels. And it can lead to earlier development of atherosclerosis and heart disease, and even potentially contribute to the risk of stroke. And the important thing about iron is that actually, although it's certainly not a good idea to be anemic, to not have enough, there's a real risk of having too much stored iron. As younger women who are of reproductive age, if people are normally menstruating, they're getting rid of some of the excess stored iron. And it's believed to be one of the factors that contributes to the increased cardiovascular risk to women as women age. Also, it's one of the factors about why women are somewhat more protected from heart disease for longer than men, that men never have menstrual cycles and don't bleed. And, they may be cutting themselves shaving is as close as they might get. But that doesn't really get rid of that much stored iron. There's something called the iron hypothesis that was, I have to go back and read my own book again. And not all the details are as sharp for me as when I wrote them, but there was a researcher who did a major piece of work on the risks of excess stored iron and made the point that in some cultures where in third world countries where people are not nourished well enough or maybe are poor, they suffer from many things, but they don't have the kind of heart disease that we have in Western countries. Significantly, they are anemic, and there are some benefits to anemia, although I wouldn't recommend it. But I think that it's important for people to realize that too much iron isn't a good thing.
Mm-hmm. Well, and in your discussion of kind of the relationship between the menstrual cycle and a woman's heart health, as well as the pill and a woman's heart health, it's really interesting because women typically don't think that their menstrual cycle health has anything to do with their cardiovascular health. And I did a very interesting interview with Dr. Jerry Lynn Pryor, who has done research primarily in the field of, the relationship between your menstrual cycle and different areas of your health. But one of the things in particular that you mentioned was the role of a woman's menstrual cycle in kind of naturally lowering a woman's blood pressure. So I would love for you to talk a little bit about that and how that works in the cycle.
Well, it's all that I can say is that for about half the menstrual cycle, a woman's blood pressure is lowered a little bit. And even a little bit can make a significant difference. Cardiologists will certainly say that they can affirm that. So, I mean, there's not a whole lot more than that I can say about that.
Mm-hmm. Well, and maybe you could touch on then, so we're talking about the menstrual cycle then, and how basically the menstrual cycle is kind of promoting heart health in its ways.
There's one other way that the menstrual cycle, the normal hormonal shift, promote heart health, which is that normally women's bodies make a small but critical amount of testosterone. And testosterone actually contributes to cardiac health. Having normal amounts of it does. And so becoming testosterone deficient is another way that a woman's cardiovascular system can suffer by having her cycle disrupted.
I think it's just so important for women to really recognize that the way I joke about it, but a woman comes fully assembled and the menstrual cycle is part of the package. And so if you take it out, people seem to think somehow that it doesn't impact anything, but it turns out that it actually impacts everything. And by removing that important aspect of a woman's health, it kind of puts everything haywire.
It's absolutely true. I mean, I know that you looked at some of the earlier chapters in my book where I go into some of the details about how complicated it all is. And I do it not so people would memorize them and be able to parrot them back, just so we could appreciate how complex it is. It's extraordinarily complex.
Yeah, I know which chapter you're talking about, because the basic understanding of how a woman ovulates, the brain releases follicle stimulating hormone, it talks to your ovary. But when you describe kind of to a deeper level of complexity, I was scratching my head a little bit. But that's a really important thing to know.
It is that and more. It's just extraordinary. It's amazing how it works.
Well, and one of the things that I found really interesting, there's a lot that I want to get into, obviously, because there's so much great information in your book. But one of the things I found really interesting, kind of shifting gears a little bit, I do a lot of pill bashing on the show, and I don't necessarily want to focus entirely on that today, but there are specific things that you talk about birth control that I want to address. And one of them was the story of how Depo-Provera was discovered. So I would love for you to share that with the listeners, because it was particularly disturbing.
There's so much about Elzamar Coutinho, who was the Brazilian researcher who wrote a book. The title was Is Menstruation Obsolete? I mean, it's hair-raising, some of it. One of the things is that Depo-Provera, it's dipomedroxyprogesterone acetate is what it is. Depo-Provera is the shot that will throw a massive monkey wrench into the menstrual cycle and do all kinds of damage to women. It was designed originally because Coutinho, and I don't condemn a person for having a theory that is worth checking out. He had the idea, he postulated, that it would be a good fertility drug. And so he tried giving it to women who wanted to get pregnant and found that it disrupted their cycle to the point where some of them didn't have a period for a year and a half. And then it became apparent that it wasn't going to help fertility. It would actually be a good contraceptive drug. And so that's how it became used the way it is now.
Well, it's just the way that you described it in the book too, because what doesn't come to mind, the actual experiences of those actual women who were, going to this doctor, trying desperately to get pregnant and being given this kind of test drug. So they were essentially guinea pigs in this process.
That's right.
And then to their horror, to learn then that they just stopped getting their periods for endless amounts of time, and they didn't know whether it was going to come back.
They couldn't have known whether they'd ever get it back.
Yeah.
I mean, that's really true. It's hair-raising, actually. It's very disturbing.
Well, and then, of course, the doctor who discovered it hails it as a big success. But of course, we are not going to talk about the women who had to go through the terror and anguish of not knowing whether or not they would ever menstruate again. So.
Right. I got the information about this through derivative sources. It was mentioned in a bunch of stuff that I found in the archives, but no paper reporting the result of this failed study to help people get pregnant was ever published.
Well, and, you touched on some really kind of deep cutting realities around health and the way that women's health is kind of addressed in our medical system. and just how women find themselves on the end of a lot of these procedures and medications that aren't fully well understood and researched. And so as much as we like to think that our medical system is so much more advanced now and that everything has to be tested and medicines on the market are safe, we're still finding that many of the medications specifically targeted at women do have these negative effects that aren't necessarily being publicized.
Well, I was very disturbed to find when Seasonal was released how poorly it had been researched. It had been tried on really a very, very small sampling of women. And I'd have to go look in my book to find the exact numbers again, but a very small sampling of women. The idea that even young women, teenagers, are being encouraged, some sports people, because it's not convenient to have your periods if you do sports or whatever, that for convenience, that it's essentially an experiment on the long-range effects of nonstop birth control use.
Well, and an experiment because those long-range tests
they won't know until it's happened, right? I mean, actually, it's only because of some data that was collected in England where, because of the National Health Service, records are kept really well, and they can go back and look over what happened 25 years ago because they have records like this, that I discovered a paper that showed just statistically what was the cause of death in women over a 25-year period, women who had ever taken the birth control pill, compared with a very large cohort. It was 25,000 women, I believe, an equal number of women who had never taken the birth control pill, comparing mortality, causes of death. And it was this that really put me on to the information that I present later in the book about the link between human papillomavirus, long-term birth control use, and cervical cancer. Because looking at the data, we could see, and this is a retrospective, you could say it was a retrospective experiment. These women weren't chosen at the beginning. This group will take birth control pills and this group won't, but because they have such good records in England with the health service, they could get the information, so make use of it at least. And when I looked at the mortality, I wasn't surprised to see the increased numbers of women who died of thrombotic, of clots and stroke, because everybody knows, or we should know, that estrogen is a risk factor for clotting and that the progestins in birth control pills contribute to deep venous thrombosis and stroke and pulmonary embolism, which is a very severe thing that young women can die from. So I saw all of that, but I also saw that a very large percentage increase in women dying of cancer of the cervix. And that was a shock to me. I didn't really get it. And at the same time, information was coming out that it had been pretty well discovered that the human papillomavirus causes cervical cancer. 97% of cervical cancers are caused by high-risk strains of human papillomavirus, HPV, that there's now a vaccine for young women. But anyway, I'm going on and on and on about this. Is this something you'd like to continue the discussion about?
Well, absolutely. That was your discussion of HPV and cancer was a particularly important and interesting one. And it's disturbing for a number of reasons. So there was an excerpt of your book then that I had put in my notes here. And basically you said it. Or no, here, I'll just read a part of it. What was news to me was the alarming number of women who used the pill and had died from cancer of the cervix. That risk appeared to increase over time. The longer that women used oral contraceptives, the more of them died of cervical cancer compared with women who had never used the pill. And now what I found most disturbing about, this whole discussion around HPV and cancer and the pill was that you said in your book that you thought that it was because of, HPV is linked to cancer. So you kind of thought that it's because women on the pill aren't using protection. So if you're on the pill, you're not using condoms. Therefore, you're exposing yourself more to HPV. And that would be the reason why there's a higher rate of cancer. But that's not what you found. So
No,
I'd love to hear you talk about that.
You really have it down so well. Tell me what you got out of the next part of what I wrote. I mean, I certainly can talk about it, but I'd like to hear it from you. It's very exciting for me to hear back what I wrote.
Well, I've talked about on the show how the pill negatively impacts, for example, a woman's gut health. And we all know that gut health is related to immune health, or at least many of us are starting to learn that. But what I've discovered from reading that section of your book was that it's not that women are contracting HPV more and getting cervical cancer more because they are being exposed to more virus. When you cited a study that was done, and essentially the women in the study, neither were using condoms. So you have women who are not using condoms and they're not on the birth control pill or any type of hormonal contraceptive. And then you have women who are not using condoms and they're on hormonal contraceptives.
Right.
But the women who are on hormonal contraceptives are getting the HPV. So basically, women who are normal and healthy then have a degree of protection. We have immune systems.
True.
And
That's
so we're
true.
not just going to get the HPV, but then the pill makes us more susceptible to actually contract
actually,
HPV. Oh my
exactly.
goodness.
The pill is a co-carcinogen. It works along with the human papillomavirus. It makes the cells of the cervix more vulnerable. Women don't fight it off as well. There are several ways that I can understand that, and there are probably reasons I don't know yet. But for example, being on the pill reduces the amount of free testosterone, but it also reduces the amount of ACTH, which is the adrenal corticotropic hormone. And so we don't have the same immune system responses. And that's a fact. I mean, certainly everybody who's ever had a period knows that there are various times of the month when you tend to catch a cold more often than other times. Our immune system is very responsive to the levels of hormones that we have. And it's affected through the cycle. I mean, I think the times I used to tend to get sick were around my period. That would be when the progestin was the first highest and then dropped off. But in a normal menstrual cycle, for a significant part of the month, we have our full boost of immune system responses. But on the pill, that's muted. And probably not only HPV, but lots of other things as well. But HPV for sure. The pill is a co-carcinogen along with the human papillomavirus in causing cancer of the cervix.
Well, and I think it's so interesting, our understanding of the way that viruses work and things like that. I think we all know on some sort of superficial level that sometimes a cold is going around and there are people who catch colds and then there are people who don't. There are people who are typically sick a lot and then there are people who aren't. And for some reason, we don't really question why that is. In our current system, we don't really look deeper into that. But it's particularly alarming that when a woman is using hormonal contraceptives, it's increasing her chances of getting sick from the HPV. So she may have been exposed to it either way, but when she's not on the pill, then she wouldn't necessarily.
The body doesn't fight it off.
Yeah.
Doesn't fight it off as effectively.
And I think personally, the reason that I could go on a huge tangent and a big rant, but I'll spare you and the listeners. But part of the reason why this is particularly disturbing to me is because, in the work that I do, I work with women and teach women how to chart their menstrual cycles and to understand what they're seeing in their chart, right? So part of the work is to track what's happening in their menstrual cycle and to kind of see what's going on. I think that a lot of people would be surprised by the number of women who I've seen who have had either cervical surgeries or have issues with their cervix and have had abnormal cells identified. Exactly. Like the sheer number, the sheer percentage then of women who...
It's very high. Well, HPV is it's epidemic and it's extraordinarily contagious. No condom will protect a woman from it.
Part of the reason why I do this podcast is to raise awareness. And I think that what it comes down to is I would never say that, no one should ever take the pill ever. I think that it's important to have that informed consent. And so if you're aware of these potential issues, then it might change your choices. So it might not mean that you never take it, but it could mean that instead of taking it for 15 years, maybe you take it for 5 for those particular years when you know whatever the case is. You know, you're in school, you're focused on your studies, and you know that you're not, at the point where you can devote energy to preventing pregnancy in a different way. But I think that a lot of women, if they had this information, would potentially make different choices, not necessarily never take it.
What we're doing is we're addressing the ideal situation. The ideal situation is a healthy woman who has no particular risk factors for ovarian cancer, for anything out of the ordinary. And so everything we're saying is applicable to women who have the luxury of having all the options open to them. And there are some women who have fewer options open. And that's the way life is about everything.
Mm-hmm. There's something I wanted to touch on, kind of backtracking a little bit and going back to Depo-Provera, because in your book, you had given an example of a woman who wrote to you, and she basically had read one of your books, and she said, I have all of these symptoms, and I think it might be related to, my use of Depo-Provera. And I just wanted to read the symptoms and then have you comment on that. So you said the symptoms she was experiencing: decrease in her usual sexual desire, reduced sensitivity of her genitals and nipples to sexual stimulation, overall reduction in sexual arousal, and decreased orgasmic capacity, and or less intense orgasms, and diminished energy levels. That is an awful list. And I think that it's kind of minimized. Doctors aren't really telling women that, and it's a big deal. I think that having the potential to have a decreased orgasmic capability, meaning that you may not be able to have an orgasm, or you have less capacity to have it, and also have less intense orgasm, that's a direct result of not having the hormone levels that you're supposed to have.
That's exactly true. And another woman reported that she complained about these symptoms to her doctor, and he wanted to give her supplementary testosterone. So he wanted to give her the shot that completely messed up everything, and then give her a drug that had too much testosterone for women to try to counteract it. I mean, it's crazy.
I've had a number of different conversations, and I think one of the very first interviews that I did back when I first started my podcast. So I think I'll have to double check the number, but it was one of the very first ones I did with Dr. Laura Bryden. And I always remember this moment when I asked her, I said, something like, I asked her what was the most common symptom that she saw of patients who were coming off of hormonal contraceptives in her office. And I really did at that time expect her to say what you talked about, that everyone knows about, blood clot, stroke, that kind of thing. So I actually expected her to say that. And, the first thing she said was loss of libido, or she may have said depression first. So it was absolutely, she may have said depression and then loss of libido. And that surprised me, because that was not what I thought would be the most common thing that would be at the forefront of her mind. So I guess from your research in this area and from everything that you learned regarding just the way that hormonal contraceptives impact a woman's hormones and everything, what would you want women to know? Like, when you wrote the book, what is the overarching message that you want women to take from this?
Okay, I'm going to say one other thing first, which is that the other major thing about Depo-Provera is that it causes osteoporosis. Women need to know that the shot causes you to lose bone in a very serious way. And you don't have to take it for very long. It varies from woman to woman how rapidly you lose bone, but it's something that people don't talk about, and it's really serious. Young women develop old women's bones, and you can't remineralize bones very readily. It's really, really, really a mess. So now, the overarching thing that I wanted people to know, really, on your website you talk about how well you know this, but I'm afraid women don't honor the ingenious way that we are made, how complex the menstrual cycle is, and that it has far-reaching effects on every organ system in the body, including the brain. It affects moods, it affects hormonal, it affects sexual desire, it affects our immune system. We didn't even mention pheromones, and there's a whole lot of stuff that has to do with the way that how much estrogen we have in our body, and the cycle of it affects the way we respond to the way men smell, and that there's an optimal pairing of the way we're made and the men we're attracted to that has an impact on the likelihood that we'll bear a healthy child. I mean, there's a whole chapter about that in the book that's pretty interesting. But I wanted people to know that we tamper with our menstrual cycle at our peril, that it's an experiment that we shouldn't take lightly. It's more complicated than even we know, and we know a lot now.
Well, and it's interesting because then there is a subsect of women who you feel could still benefit to some degree from the pill, even given the conversation that we have. For women who are listening to this episode and they're actually taking hormonal contraceptives, and maybe this is the first episode of the podcast that they're hearing, this is their entrance into the show, should they run out and throw out their birth control pills? How acute is this problem?
I think that it's really important for people to try to listen to their own bodies, to pay attention to, what they feel. I mean, people who've read this book have responded in many different ways. I've had, one person who said that I am some kind of a nut because I didn't mind having periods myself when I was younger. I mean, we vary so much one to the other that, there's a bumper sticker that says, education expensive, try ignorance. I mean, I do the work that I do in this arena to educate people. I mean, we ultimately have to make decisions for ourselves. With the help of our doctors, we may want to turn it over to them. It's easier, but it's not responsible. I mean, I think you really need to take responsibility for your health more.
I really agree with that. That's been kind of a theme I found in several of the interviews I've done recently, where it really comes down to the fact that I always say nobody cares. No one's as invested in your own health and fertility as you are. And although you may have, people on your team, you may have a doctor that you go to, and you may, have a psychiatrist on your team, you may be seeing a naturopathic doctor, but you may have, people that you're working with. And ultimately, the idea that our doctors know best and we should be in their office and we should kind of it's like that paternalistic model where your doctor is kind of like that father figure that you can't question, and, whatever your doctor says goes. We're moving past that, and you really have to be the one to look at what is working for you. And you can't just take everything that's told to you and just go do it. You really have to be, like you said, taking that responsibility for what's happening and really tuning into how you feel and if these things are actually working for you.
Well, in that regard, I have a great deal of respect, Lisa, for the work that you do, because, it helps when women can support one another in this way. And, and it's hard to go it alone, but taking responsibility for yourself doesn't have to be just a lonely enterprise. And that's why I wrote my books as well.
Mm-hmm. Well, and one of the topics that you touched on as well is kind of that idea of big business. We touched on it already a little bit in terms of having women be kind of guinea pigs in this process. But I'd just love to hear you talk a little bit about this trend where women are being sold the idea that menstruation is obsolete, but ultimately the reason that we're being sold that idea is so that we can be sold products. And I would go so far to ask the question of, whether or not the HPV vaccine was developed because they're recognizing that since so many women are on the pill, there's this huge increase in HPV and cervical cancer.
We're pretty far down the road now because HPV is an epidemic. We'd have to go back and say, well, if the pill had never been promoted, if people had never used it or hadn't used it to the degree that they do, because now 25% of women on birth control, at least 25% are using the pill still. If that hadn't happened, would HPV be the way it is? But given the fact that it is, I think it's a good thing that the vaccine has come up. But yeah, one compounded mess after the next. messing with this stuff. The pill is a very good contraceptive if it were used judiciously and limited to specific uses. Women at high risk for ovarian cancer, women who have kind of epilepsy that is connected to hormonal cycle changes. There are women with terrible endometriosis. Conceivably, there are some specific uses for the birth control pill. But as something to be used in a general way, causes a lot of complicated problems.
Yeah, no, absolutely. And hopefully this interview and, your book just raises the awareness and kind of sheds light on some of the issues, some of the complexities, some of the things that you wouldn't necessarily think about. Because as much as I've kind of seen that for myself, the way you laid out in your book, just the way that our menstrual cycles and also birth control pill use is connected to these different things: heart health, bone health, hormonal health, sexual desire, and as well as HPV, the immune system, iron, heart health, if I didn't mention it, again, blood pressure.
I'm impressed at how carefully you read my book. I'm really impressed.
Well, this is an area that, obviously this is an area that I'm passionate about. And this, the topic of your book is of interest to me. And I know that it's a topic that's of interest to my listeners because some of the podcasts where I've addressed the links between having a healthy menstrual cycle and having a healthy body are some of the most popular. And it's because women are really just fascinated and a little bit disheartened, to find this out kind of later than they had wanted to.
Why didn't anybody ever tell me this? Right?
Yeah. So that's an email that I get weekly, at least.
Right.
I'm so happy to have found your podcast. I wish I would have known this 20 years ago.
Right.
So I'm really thankful, for the work that you've done. And I guess before we wrap up today, you also wrote a book that I have not read, The Hormone of Desire, The Truth About Sexuality, Menopause, and Testosterone. So before we leave today, I would love for you just to kind of touch on, you've kind of touched on already why you wrote the book and these topics are complementary, but maybe just a few takeaways from your research in that area.
I don't know where to begin with that, to tell you the truth. In telling you my story, which is that I didn't feel right as I approached menopause, and that's what got me into writing the book. I really can recommend it. It's very readable. And the whole dealing with the physiology and function of testosterone, while not absolutely simple, is really much less complex than what I wrote in the book, The Blessings of the Curse. And Lisa, if I could, my most recent book is a memoir. So if people are interested in how I got to be who I am and in the story of a woman who does not present herself to be victimized and how it came to be. The title comes from a line from a song by Leonard Cohen, which is, "There's a crack in everything. That's how the light gets in." The title of the book is That's How the Light Gets In, because I think it's the story of everybody's life, that imperfection is part of what allows us to grow. And I'd be thrilled if people were interested in taking a look at it.
Well, I'll certainly link to all of your books, the two that we mentioned, as well as your new book in the show notes page. And to end the show today, I just have a few final questions that I typically end with. And so one of them is, what would you say is the biggest myth about fertility that you would like to see corrected?
The biggest myth about fertility. I suppose one of them is that there's a way other than following cervical mucus to know when you're fertile. That you can't just figure out when your next period's going to be and count back 14 days from it. That fertility doesn't follow a calendar that way.
There's more to it than that.
Yes.
So this is the last question of the day. For a woman who's currently on the pill and she doesn't want to get pregnant now, but she is thinking about pregnancy within the next couple of years, what advice, if any, would you give to her?
First of all, don't ever have the shot. That could really mess up your fertility for quite some time to come. And I think it would be a good idea to get off the pill as soon as possible and use a barrier method, use diaphragm and condoms. But, the kind of thing that you're teaching gives people a much more natural way of knowing, very good way to become more in touch with your body. And since you're planning on getting pregnant, then you have the luxury of not worrying quite so much, oh my God, what if I do?
Mm-hmm. Well, I think those are great words to end on. Dr. Rako, I just want to thank you so much for being here today. It was such a pleasure to have a chance to talk to you and hash out your book. It was really great to be able to talk to you about these really, really important topics.
Yes, well, it's wonderful to talk to somebody as intelligent and well-informed and open-minded as you are, Lisa.
Well, thank you so much. That's really sweet of you to say. And so for our listeners who are, excited or a little pissed off maybe, or inspired by our conversation today, how can they find more about you and where can they find information about your books and your work?
Well, I have a website, SusanRako.com, which is pretty easy to find. I think that's probably the best place. But, the books are available on Amazon and available on Kindle as well and have been translated into Japanese, Spanish, and of all things, Finnish.
That's incredible. Well, congratulations on the continued success of your books. And thank you so much again for spending the time with me today and just being so generous with your knowledge and your experience. Thank you for listening. If you enjoyed today's show, please share it with a friend who you know will benefit from it. You'll find the show notes page for today's episode at fertilityfriday.com/95. I really enjoyed my episode with Dr. Rako today. As you can tell, I really enjoyed her book and just about some of the topics that she delved into in there that I think are really important. The message that I hope that you get from this podcast is just how important it is to be informed and educated about anything that we're taking and anything that we're incorporating into our lives. I think that with the birth control pill, I think any of my longtime listeners will know that I have some specific, serious, and legitimate concerns with the birth control pill and its impact on the body. And it's never to say that a woman shouldn't take the birth control pill at all in her life, because I have taken the birth control pill myself. But I really believe that if women had all the information and all the facts about the way that the birth control pill acts in the body, how it can impact a woman's hormones and how the effect that it can have on her libido, the impact that it can have on her cervical health, and even how it can impact her susceptibility to contracting something like HPV, which then increases her risk of cancer the longer that she's on the hormonal contraceptive. So I really hope that this interview rose some awareness for you and just kind of inspired you to really delve deeper into this topic and, really research and know what you're taking. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or a guest suggestion, make sure to send me an email at info@fertilityfriday.com. And I just want to thank you so much for hanging out with me today and letting me be part of your day. I appreciate all of you for taking the time to tune into the podcast, whether you're on the go, whether you're hanging out with, well, hopefully you're not hanging out with friends, because then you'd be ignoring them and listening to the podcast. But whatever you're doing, thank you so much for hanging out with me today. And as always, until next time, be well and happy charting.